Good afternoon. I'm Dr. Nicola. I'll be carrying out your mole removal procedure today. Alright, so I'm guessing it's this one. Okay. Let's have a look. You can feel all that. Just a measurement. Okay. Okay, wonderful. Just feeling around it. It should come off nice and easily. Does that feel alright? Good. Okay. Spin my things over. Alright, so keep nice and still for me. Okay, that's fine. So, what I'm going to do is inject around the area, okay, with a local anaesthetic that will numb it. Alright, then I will remove the mole. Okay, you won't feel a thing, my lovely. Alright. Okay, don't look so worried. Okay, you're in safe hands. Just sit there and relax for me, okay? Good. So, it won't take very long at all. Alright. So we haven't got to worry. So, okay, you can just turn that way slightly. Okay, come back. Yes, it's very dark tone, rigid edges. Okay. How long have you had that? Okay, and you've noticed obviously it's gotten bigger and more irregular. Okay. You did the right thing by getting it checked out, my lovely, okay? The quicker the better, so I'm really pleased about that. You haven't left it lingering for ages, so that's good. Okay. So I can just stretch there. Okay, it's tight around the edge. Let me just have a look. Yeah. Obviously, I can't be sure without obviously getting it tested, but you know, it is quite large, irregular, a dark shade. It has got more irregular, so yeah, but obviously I can't give you a definitive answer until we've checked it in the lab. Okay, but what I will be doing is removing it all today and just the surrounding little bit as well. All right, my lovely. Okay. That way, there. If you just smile for me. Yeah, see the skin around that goes a little bit tight. Does it feel tight? Okay, relax. Would you mind puffing your cheeks? Okay, relax. So just by looking, your skin is quite dehydrated, which that is pulling on it more with it being dehydrated, my love. Yeah, so it could be why it's feeling a little bit more uncomfortable. Yeah, okay. Doesn't hurt though, my love. Okay, just uncomfortable. Okay. And you can feel around there. So you can feel everything I'm doing. Yeah? Okay, good. That's fine. So no loss of feeling, which is great. Sorry, when did you say you first noticed the patch? Yeah, describe it to me. Yeah. Yeah. Pigmentation. And right, it started getting bigger, raised, rough. Okay, and okay, right. So it's fairly quickly between there and then. Right, like I've said, you know, you've done the right thing. You didn't leave it for ages, which is great. You know, and you're here now, so I can see why they've recommended for it to be removed and obviously tested. So, you know. Okay. Have you had any bleeding from it at all? Any discharge? Okay, that's good. So, I know it's uncomfortable. Does it irritate? Does it itch? Or anything like that? Okay, that's good. Perfect. Okay. Yeah. It's going to be pretty straightforward, my lovely. All right, I know exactly what I'm working with and where I'm going to make the incisions and where to put the injections. So you haven't got to worry, my love, okay? Just like to double check everything before I get into the actual procedure. Okay, good. Wonderful. Okay, that's that. Good. Okay, right. Are you happy for me to carry the procedure out today? Okay, would you mind just signing the bottom there for me? Okay. Thank you very much. Good. Right. Okay. What I'm going to do now is just clean the area. All right. Okay, that's nice and clean. Just make sure all around that little bit as well. Okay. Okay, that's ready. Okay. I'm now going to inject the area. Okay, if you turn that way for me slightly. Okay. Okay, will be a sharp scratch. Alright, my lovely. Sharp scratch. Sharp scratch. Sharp scratch. One more. Okay. And a bit more there. And one last there. Okay, wonderful. You okay? Okay. And dab that around there. There we go. Now I'm just going to wait a few minutes just for that to go numb. Okay. Can you feel that? That? Can you feel anything? Okay, can you feel that side? Yep, that side no. Okay, together. Good. Perfect, so you can't feel a thing. Wonderful. Glad to hear that. I'm now going to make a small incision, okay, my lovely, at the bottom, and then just around the sides, okay. Alright, now can you feel that on your skin? Okay, good. Now if you just relax for me and close your eyes and just focus on your breathing. Alright. Okay. You okay? Good. Okay. You're doing really well. Well done. Okay, good. Okay. Just want to okay, my love. I'm just making sure I have everything okay. Wonderful. Still feeling okay? Okay. Alright, so I'm just going to wipe around the edge, not on the actual wound. Just to clear up anything that needs to be clearing up. Okay. 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 I'm just going to tape this on you just for a short while whilst I prep the stitches. Okay. You okay? Good. So I want those. And I want this. Okay, I can use that. And we will need to pop some of these on, I'm afraid. Okay. Good job. Right, we keep nice and still for me, okay? Okay, I'm just going to do some stitching. Okay. So I'm just going to pop some of these on as well. You okay, my lovely? Good. And this one. Right. Perfect. Okay. Can you feel anything, my love? Nothing yet. Okay, good. That feels nice and smooth now. Alright. I've cut away all of the mole and from down within. Okay, I've took a little bit more from the edge, so I don't just like to take just the mole, I like to take a little bit around it as well to make sure it's all gone. I've stitched it slightly, which will dissolve, and I've popped some of these on to hold it together as well, my love. Alright, and they will obviously just come off. But what I am going to do now is cover that up. I'm happy with it. There's no bleeding, there's no discharge, there's nothing abnormal at all. It looks perfectly fine. And we just need to let that heal. Okay, so I'm going to pop this on for now. You can remove this in the morning. Alright. But I just want to keep it covered just until then. Wonderful. Does that feel all right? Good. So that is the procedure complete. As I said, it looks fine. I'm going to take all this down to the lab. It's going to get tested, and we will let you know the results as soon as we can. All right, my lovely. But it has all gone. So if there is, you know, anything untoward or anything like that, it's fine because it has been removed now. Alright, but obviously we will check, and if there's anything else that needs to be done, then we can call you back in and we can go from there. Alright, please refrain from touching the area as much as possible. Alright, my lovely, just let it heal, let it do its thing. Now, any signs of infection, please go to your doctor straight away, or in severe cases, please go to A&E. Alright, my love, but you should be okay. Just let it heal. Avoid using any skincare or anything like that. You can pop a little bit of antiseptic on it in a day or two, but other than that, try to just leave it, get the air to it to help it heal, and yeah, it would just eventually settle down. Alright, my love. Yes, you will have a bit of a scar, my love. I have obviously pinched it together so it's all nice and flat and you haven't got a hole there, but obviously that is going to scar. Alright, my lovely. Okay, but there is things down the line that you could do if you wanted to get rid of that, but you know, that stopped the mole growing anyway, and you know, gets rid of all the risks. Okay, my lovely. Any questions? Okay, but what I will do is email you everything over with what I've done and the plan and any advice and things like that. Okay, I'll get that to you for the morning. All right, and then you can have a read through when you've got a chance. All right. Okay, so I will just need to shut this down. Okay, so successful mole removal. Okay. Good, happy with that. Right. Okay. Does that feel all right, my love? Are you sure? Okay, let me just feel over the plaster. Okay, good. So the anaesthetic will obviously wear off soon, all right, and you probably will be in some pain. So please take some paracetamol or something like that, okay? And you can take some ibuprofen or something similar to help reduce any swelling. All right, my love, but just be cautioned that, you know, having too much ibuprofen, it can thin out your blood, and if you start to bleed or whatever, it can make it a lot heavier. So please be careful with that. All right, but I'm happy with everything, and I will see you in a week just to see how everything has gone on. All right, and I can give you your results and everything as well. All right, my secretary will sort that out for you, my lovely. You're very welcome. You take care now. Bye-bye.